All right, everybody, I'm Charles McFall here with the We Serve Network at weservenetwork.org, and I'm here with Jeffrey Schwartz of My Safe Pass, and we're going to talk about some awesome new tests that are hitting the market. Well, they're already on the market right now, I do believe, right, Jeff?
Yes, sir. They sure are. They're out.
What is My Safe
being
Pass?
Used pre-COVID, 2019. I had some friends involved in supplying our U.S. military some needs. And they had contract orders and a request that they'd been fulfilling for years for the Army, Navy, and wide range of products that they had been contracted for. And they were issued a need for a test to test for this possible new virus that they thought it was going to hit, and they were scared, and they were out searching for an answer to be able to keep our military safe from this virus that could possibly endanger our national security. A friend of mine that operates this the supply for these government needs reached out to me, and he said, "Hey Jeff, I got this thing. This virus is coming." And they're scared that it's going to really make a lot of people sick. This was COVID, pre-COVID. And, well, I need to find a test. So I said, okay, good. How many do we need? And it was a lot. And I was like, oh, Lord, okay, wait a minute. We need to hurry up and find a solution, which led us to a number of different target areas, pharmaceutical, testing, research. We landed a company that we felt was the most progressive in viral screening, other than a viral blood test, which takes too long to take. And there's a number of reasons why that wasn't going to work. I've known since polio how viruses are spread. They're airborne. They invade the least protected cell in your body, which is the ACE2 receptor, which is 600 times more prevalent in your olfactory bulbs, which are two bulbs that are located in the frontal cranium of your skull, detached outside of your brain, that pick up scents through your nasal cavity, through olfactory endings, grab these scents, and then relay these different messages to your brain to let you know what you're smelling. And these receptors that are used are the ones that viruses invade. They have the least protection amount of cilia, which is a substance that protects the exterior of the cell from invasion. They're the easiest to infect. So viruses have learned to get into your body and find the ones they can get into and multiply quickest. And that's
is that why the cold spreads so easily and why we get sinus issues more readily?
Really, it's true. And how we fight those colds off is our ACE2 receptors that are invaded have ability to multiply quickly. So dependent upon the severity of the virus, you can fight it off, and your ACE2 receptors die and you grow new ones. Then they just over multiply and you get a cold for a couple of days, then it goes away, right? Or sinal, something that happens airborne that gets in your body, whether it's a allergy, there's a number of different sinonasal problems. But it's really interesting that a lot of people were looking at blood tests, but we thought the quickest solution, and we've known since polio how viruses are spread, how can we detect ACE2 receptor damage? So this was really a cool idea that we went towards, and not too many others did. And we thought everybody was going in that direction, and people were like, "What are you talking about? What are you doing?" Well, look, here's what we found: a Swiss company that had a test that was a scent test. That our test has become a scent sensitivity and scent recognition test, and give you an idea how it works. Is as you noticed when COVID happened, people were losing their ability to smell.
Yes.
Right. And that wasn't even on a CDC list of conditions until we notified them. By the way, loss of sense of smell is a COVID condition. It is a viral condition. that's usually asymptomatic. You don't know that you have it until it degradates to the point where you
Right.
do know
Which is
you have it.
most viruses, it feels like.
That's right. Now, some viruses, you might get a virus and not get
Right. You're
sick
just a
from it,
carrier. Yeah.
but you're just a carrier. That's everyone got COVID. Everyone gets all of these viruses, but some people are more susceptible, can't fight them off as well as others. And those people that are asymptomatic are spreading
Right.
it. They don't know they're sick, and they're just getting all these people sick. Don't know, and these people can't fight it off. And then the people with very weak
Mhm.
immunities or abilities to fight off these infections, they're more susceptible to become really sick. So this is really interesting. So it led us down this rabbit hole of, wait a minute, we've got to detect this not after you're sick, because that's what COVID testing went towards. Oh, we're going to tell you what you have after you got it, and after you have a fever, and after you're sick, and after you have diarrhea and you're in bed. We're going to now tell you what you have. You don't need to tell me what I have. I'm sick. So I need to have a test that tests you day one. So if you are a carrier and you're infected, I can treat you and keep you protected from causing a spread. And we didn't know that. That's why it spread like it
Right.
did. Everyone that got 50% of the people that had it didn't have symptoms. Where the other tests that kind of took over the market with a lot of backing from pharmaceutical, that even though these tests, the tests that were provided, really, they were not good. You know, they worked 50% of the time. They would test positive under running water. You know, these tests were that came out kind of blocked the market because they were cheap, affordable, and quickly produced. You know, China could produce 1,000 a second, and that was the solution the pharmaceutical companies got a hold of that kind of blocked any other testing from coming in FDA. And it became the accepted test, where our test was right in line, and we did use our tests. We had some groups use these for specialty clean areas, to keep
Sure.
special areas clean. You could take this test at home and it would pass or fail you, so you could go to work that day. Well, with a PCR test or any of the other tests, you have to have a viral load of up 3 to 14 days before you get a fever. Most of the tests that you would get, the antigen test would say fever, headache, diarrhea
Yeah.
test. By then, you've already spread it. You've
Yeah.
had it for 2 weeks, and it's really just letting you know that you have a virus that you already know that you have. So really wasn't a solution. Anyway, so this progressed where we got with many different and licensed and partnered with many of the leaders in olfactory disorder internationally. And it became a fun, expensive effort for us to collaborate, gather information, and put people together that were not collaborating for financial reasons. They no, we're doing this way and we're going this way. And these guys everybody had different
Yeah.
perspectives and different solutions, but collectively they didn't work as well as if you put them all together. And they were missing one final. Many of these tests have been out for decades. You know, the FDA has 5 or 6 of these tests, but they're anosmia tests. And anosmia is when you lose your ability to smell. Hyposmia is when you have an asymptomatic sensitivity, scent degradation that occurs that goes unnoticed. And you don't know you have it, but our test can show that you have a current olfactory disorder. Over the years, you've heard people adding salt to their
Sure.
food as they get older because their taste goes away, and that is the occurrence of an olfactory disorder that's not normal, that's caused by certain things. Olfactory disorder and hyposmia is a symptom of a medical condition. It is a symptom of
Okay.
a virus, a viral infection. It is a symptom of 144 neurological
Well,
disorders.
that's a lot of
It is the only, it is the like um hyposmia occurs up to 10 years prior to shaking from
Okay.
Parkinson's. These are all medical facts that are all NIH, PubMed. We've known this. It's how to create a hyposmic reader. That's this test. No one else went into that level of testing. We did because we saw that light at the end of the tunnel. This is a symptom screening test that uses hyposmia to help find medical disorders that are not present in any other way. So it's blown up, and 600 studies, and we've got more than most medical companies have ever had in their lifetime, just on
So
olfactory disorder.
you have a bit of
So
a background that led you into thinking this way. Where did you, I mean, we've all had a winding path through our careers, but what brought you to the
yeah,
skills that got you to hyposmia testing?
that is just I had to find out why I was so weird later on in life, just psychologically, and it came down to this. This is pretty interesting. After really studying myself to be better mentally, I found that I had some character defects, and one of them was major insecurity. So I've come to find out that insecure people like myself overachieve to feel equal to normal people, and they never get to that level of normacy. So it's my constant need to be accepted caused me to overachieve because of my character defect, my insecurity, which today it's an asset that I had it, that that you have it, you can turn it into an asset. So I started studying at a really young age, and oddly, a wide range of things. And luckily, I had great parents that allowed me to investigate many things at high levels, and specialized schools that I went to that I either got accepted or and had some help from my family. Went to school, went to medical school at 16. That was through my at 15. It
Okay,
was through my
gotcha.
high school. I graduated earlier than most, and I was really too young. But my curiosity need took me into a 10-year scholastic career that was versed in different realms. Cellular biology, endocrinology was really what I loved. And then architectural, electrical engineering, master. So I've done just a wide range of things quickly, and I wasn't really worried about the sheepskin. I just wanted to take things that I liked. My parents didn't like that very much, but I ended up as a
What?
geologist. I've been just wide, yeah. Creation of the universe was
Sure.
interesting, and it led me to as different fields that I was interested in. But I became a real estate developer, successful, and made a little bit of money so I could do some fun, interesting things that I liked. And luckily, I had some good partners with this that allowed us, where most people don't have that kind of funding, to fund the research and the creative aspects of producing a medical device without public funding. And so it's privately held. Generally, an idea like this with enough reputable people would
Sure.
launch it publicly to raise capital, but we were fortunate enough to be able to afford the meet the capital needs. Which is arduous. It's an arduous process. The FDA, we're a FDA Class 2 registered medical device, and it's non-invasive, non-biological. It's very rare. Class 2 medical devices are reversed for biological. Usually,
Okay.
pregnancy tests, for example, is a low level. Uh, and then Class 1 registration at FDA is for a lot of things that could be harmful if you ingest, and that are safe. Sugar. But because of our testing, it led us into this great field of testing for hyposmia and all of the conditions related with hyposmia. There's 7. Sinonasal. You hear about 5% of our population have a scent disorder that's harmful to them. It causes Great Depression. How to reverse uh, uh, olfactory disorder is another field that we're in. olfactory or ACE2 receptor regeneration. We've got so people that have lost their scent.
Sure.
Some
Yeah.
people get hit on the head in an accident, lose their ability to
Mhm.
smell for the rest of their lives, and this is a really harmful psychological thing. So that area is, but there for us that we're pushing for, prescriptions that would allow people that have olfactory disorder to regain their ability to smell. And we have
That
promising
that is
areas
that
in that
is
field.
amazingly. When I say insane, I mean like it's science fiction almost. It's the future. It's
Yeah,
crazy.
yeah, yeah. It's like your body helping your body
Right.
repair itself, not implanting. There are implants and that stimulate, but the kind of accuracy that your body produces, it's uh, it's led us into some other things. But here's the really cool stuff about this test. We um, we can use this test. Give you an idea how special this is. The top 6 leading causes of death.
Mhm.
You have heart disease. You have within those 6, the third leading cause is the medication for the 6. you cause it. That's crazy, right? The medications that we take to offset one cause illness in another form. Being able to detect disease at their earliest stages is a preventative care measure. It's like, I'm going to get a cold next month. I'm going to go ahead and prep for it so I don't get it. I know I'm going to get it. I got to do some things to help prevent that from happening. So I know I'm going to have it on this day. So I'm going to go ahead and
Yeah,
vitamin
right.
C up and mineralize up and hydrate up.
Sleep.
And then I may not even have the
Yeah.
symptoms of it. I know it's coming. Well, these preventative care measures weren't really attacked by the medical industry because of their cost until the cost of non-preventative caring has overwhelmed the medical industry to the point where our government is having to assist these top 5 in covering costs outside of the
Mhm.
Medicaid ability. So, um, an Alzheimer's patient, Alzheimer's has only been around since 79. They didn't know it was just a neurodegeneration. They thought people were just had problems. They've labeled this because it affects the exterior part in your memory, where different neurological disorders are targeting different parts of your brain. Some are motor skills, some are memory. You got me. Some are coordinative. So all these,
Sure.
there's so many different parts of your brain that can be affected. To be able to detect that you are leaning towards getting one, then I can take preventative steps, mainly diet change. And you'll see over the next 5 years as this will come out, most of our neurodegenerative and heart diseases are not cholesterol related. They are caused by the release of uh, um, too much sugar and high glycemic foods in our diet, cause our endocrine system to release
Insulin.
uh,
Yep.
insulin. And insulin is a guy that runs around in your body
Yep.
that opens up
Mhm.
cells to shove sugar in it. And if those cells are full, the receptors are getting rubbed off because you have just a constant bombardment of glucose in your blood, and your body's need to get rid of it. The only cells that it can go in, it scrubs off the receptors of
Okay.
your brain, your heart, and all your organs as well. Insulin is the criminal that we started bombarding our bodies with in the early 60s, 70s, and 80s, and has continued on due to our diet and food manufacturing change. And before our whole foods were there, before we had mass ultra processed foods, you can look at a video of New York City in the 1950s, and there's no fat people. You had to pay a quarter to see someone that was overweight
Hmm.
at the circus. There were no fat people. There was 1 to 2% overweight for a medical condition. Now it's the reverse. Go look at a video of today of people walking around Manhattan, 80s, 90s, and it's increasing. The obesity rate is due to high amounts of carbohydrate and your body's inability to use stored fat as energy because you're not absorbing all the glucose that's in your food. and you never get a chance to use any stored fat as energy, which is your vitamin saving storage, energy storage packs. And when you're eating constant non, carbohydrate and sugar, you're just a walking glycemic index. And we didn't know that. And now the health people are having to get on board to save us, but they're not changing the diet. Now this test triggers the change in diet.
So my Safe Pass does two different things, more or less. You can do preventative for the brain degeneration, and then you discovered in your research that you mentioned getting hit on the head earlier, that it can actually be an early detector of concussions.
The only symptom of mild to moderate concussion that can be measured is hyposmia. There's not a PET scan, CAT scan, any kind of blood test. There's some that are very unique that show proteins that are released during a concussion that are very expensive and time consuming, but they're very rare, very hard to get to without a recommendation or an ailment, right? By the time you take the test, your concussion's gone away. You follow me? So a mild to moderate concussion, other than a TBI, which is a major traumatic brain injury, that's noticeable. You can't see, you're knocked out,
Right,
you're
the big
dizzy.
ones.
But your mild to moderate concussions are where you get hit on the head, you have a brain bleed, where a rupture and there's some bleeding, and it disrupts your ability
Or
to
even
smell.
brain bruising, right? Because bruising comes from the micro bleeds.
Right. Yeah, that's scarring and bruising occurs. Repetitive hitting on a scarring area. So if you let it heal, your brain has the ability to regenerate, which is unique. It's like your liver. So mild to moderate concussions are a normal since cavemen, wrestling, fighting, falling out of trees. We got to be able to mend ourselves of these concussion instances. And we have that ability. And our brain has the ability and protection. It's like a built-in helmet, your skull with some endoplazma that allows some protection to occur to bumper those effects from running and jumping and falling and playing. Well, in contact sports, when you get hit on the head, you just shake your head off and go get back in there. You're having so much fun, you don't want to get stalled. Sometimes you don't know that you have one because your adrenaline. And so we have our concussion screening test. That's a 60-second rapid sideline concussion screening test to help protect our kids in the event that they fail this test. There's a good chance it was caused by that concussion hit. So we do a baseline test for a school. We to see who currently has a disorder and who doesn't. So then they can take it throughout the year upon suspected concussion. Oh, got hit on the head. Charlie, do a test. Oh, you failed it. They do a secondary test to increase its accuracy, even though it's accurate in detecting hyposmia. They do a secondary test just to eliminate about 8% human error if they fail. And if they fail, that triggers further insurance covered testing and alerts that coach and that player, hey, wait a minute, I got something going on here that's triggered this, and it's more than likely concussion. It's especially if we do the baseline testing and keep testing them throughout the year using this test. Now, there is no other way to detect concussion. The blue tents on the sidelines in the NFL, they have a book they open up and they say, how many fingers do I have? Can you read this? Cognitive tests that mild to moderate concussion don't affect your cognitive ability. It's usually a TBI. And they just want to make sure that the player isn't lying. The player can't see straight. Put me back in, coach, right? And I don't want to lose my job.
Exactly. It's very much. I'm sorry. It's very much like a paramedic. I've been a paramedic I've been in the medic field for 30 years, and running car wrecks, running those injuries it's very much strokes. Okay, we can tell you to remember some words, and if you remember them, okay, you pass that test. Grab my hands. Okay, you pass that test. There's very little we can do, like you said. It's all cognitive. If it's a minor brain injury, being a stroke, a head injury, or anything else, we just can't tell. And I know from science that when you're in that car wreck and you rock forward and rock back, your brain does too, and it bounces off your skull. But sometimes it just doesn't do it. I'm saying this in the wrong way, but it didn't do it hard enough. There you
To the
go.
level,
The
to the
level of
level of
measuring. Thank you.
measuring. Yes.
And
Yeah.
this test, my safe pass, will let us test on the street, let us test in the back vans, let us test on the sideline, let's test anywhere for low to
Yep.
moderate concussion or brain injury.
This is a huge deal when it's been missed and then a secondary hit or a misdiagnosis occurs. So this assists in diagnosing your patient or your player and further protecting them from harm or alerting them for the need for further testing. ER, accident, emergency medical techs, fire, police, wherever somebody falls off a ladder, in a car wreck, these tests can be available. And now here's one of the greatest things. Most medical devices are not insurance covered.
Right.
And there's a cost to those tests. They just don't meet a certain criteria or level of, or
without causing a whole lot of controversy. 30 years in medicine, I can tell you, trying to justify insurance costs versus actual medicines, two different conversations, and the hoops we have to jump through to say, I did this for this reason, so please pay for it, is a big deal. And even if they do pay for it, sometimes they're like, well, that test costs you $50, we'll pay you $5. So you're saying, it sounds like you're saying that this test, because it is affordable and easy, the insurances love it, and it helps determine whether or not you really need those expensive tests.
Right. This is a preventative care measure that is going to save our country trillions, not with a B, but with a T, and offset medical costs due to early detection and preventative care measure. Give you an example. Just a few years ago, Alzheimer's patients they had a 3-year life expectancy. It's 20 years now. But the care need is now from 3 to 20. This preventative care measure allows us to alert people, hey, there's some things that you need to change that are proven to prevent further escalation of this disease. And if I catch it at its earliest form, then you may never get it. In other words, this could prevent you from escalating another 20 years and you're 60. You follow me? So you're just the quality of life, the cost savings to insurance providers have allowed them. They encourage this use. Our card, we have the neurological screening card and the concussion card. They both do the same thing. They're very similar. They just detect hyposmia. The scents rotate. There's very ingenious, the manufacturing process, encapsulating the scents, laying them down ISO printers, mass gowns, and making them precise. It's very technical, ingenious. But here's the greatest thing of this test. As it goes into doctor's office, and they use this at the patient assessment stage of their greeting their customer, this can be used like blood pressure. Is a blood pressure cuff.
Sure.
Now, that's a simple test. What's your blood pressure? Well, it looks like it's changed drastically and it's really high. Or it looks like it's really, really low from your last 6 months or 2 years. Something's going on. That is a symptom of an underlying health disorder that we need to go further investigate. Now, here comes your third test after your weight, your scale, your thermometer is a hyposmia test. Oh, looks like you got hyposmia. We can further treat that because it could be a major health disorder that we can, thank God we got it early enough, just like your blood pressure.
That's the only time. That's the only time that money and health come together. Is we as humans, we just want our family members to be well, right? My grandmother had Alzheimer's, and it's rough. It is rough to watch that go down that hill, and just the brain loss that's there. And so we just want, grandma to be safe. I want my kids who play contact sports to be safe. That's all I want as a human. And then on the side of the insurance, they're playing a statistical ball game of where do we pay and where do we not pay. And they want They want to be able to make your family member well. We hope they want to make your family member well, but also they want to save money. And this is where it comes together of this simple, easy to use test brings the best of both worlds. Where the insurance is like, yeah, done, because now we know we can prevent these steps to Alzheimer's. Or what, does it work on Parkinson's as well?
Yes, multiple sclerosis, some
Oh,
Huntington
okay.
disease, which is on the rise. You're going to see a lot of really interesting things that are going to change us and make us healthier. And this preventative care measure is a godsend. I mean, I can't believe that we got a utility patent on this when people have been trying to patent this stuff for years. Somehow we've got that registration, which gives us some protection on our product and helps us recoup some of our years of costs. But being able to make this affordable is number one. It's really not a money thing; it's a fun thing, and we've had so much fun making this. It has just been mind-altering learning
So
experience that I couldn't pay for. I couldn't. I just couldn't imagine it'd be so critical. But using this in every doctor's office, 800 million doctor visits last year in America. 833 million doctor visits. This test could have been used in, and our goal is to get them used as an assessment stage and get the cost down. When we start getting that volume, I mean, they're right now. This test is a non-forced copay, that making it 100% insurance covered test, no cost to the public. The insurance companies will pay depending on your coverage, but the doctor does not require to force copay the balances. And so we've made a deal with our doctors to eat that cost and reduction. And so they can start using this test, and it gets a wider range of use, the more people it's going to protect. And then our mass production will take place and we can get these things, they're like candy, right? And our goal was globally, we're reaching, the
okay.
EU. We've got our CE certification, and everybody, we've got some countries wanting to buy it to give it out. Saudi Arabia, they want to buy it for 14 countries and
Okay.
give them out for free. That is how important that is. Just there's some really neat things going on with it because people see how important it is. And preventative care measures, especially with the current ones that are on
I
rampant
gotcha.
rise.
And do you see a future where this is something they can just pull off a shelf at CVS and take home and test your loved ones?
Well, yes. One thing to any kind of product, unless it's administered by a health professional, is a
Right. Right.
non-diagnostic,
Right.
non-diagnostic tool. Until we can get the cost down, like Tylenol, was $30 a pill, and
Yeah.
and then and now you can buy
Yeah.
it in a
Yeah.
jar for $5. But to have a doctor use this test to diagnose a patient, this could be sold in the store now, that would trigger them to call their doctor. It's pretty technical when you do one of these tests. Give you an example. Here's one. This looks pretty simple. This is like the swab to the
Okay.
antigen test. And then the back end, your medical provider, these are on your like
Okay.
on your
Mhm.
sidelines, in a box, or in your
Yep.
EMS truck. And hey, let's pull one out and use them. Um, and you open this test up. It's really interesting. Um, you open this test up, and there's instructions on the back, but it's pretty
Sure.
elaborate. There's a couple of things. It's not like
Right. Right.
just swallowing a pill, right? And then there's some specific instructions that allow you to access this test and then smell these scents in a certain order. And then there's some videos on the site. If you could put that site, that Patriot Connection site, there's some tutorial videos. I'm seeing people how they use it, and there's actually a practice test. So you can actually practice one on the site without the test, and it gives you the answers. You would scan with your phone, and you access the web app for this test. That a big testing process and a data accumulation, and all this stuff pops up. You enter your name, and your drop down box of the doctor's office where you're at, or the football game you're at, or the team you play for that's registered. So After you turn that on, enter that information, you scan the QR code, and then you follow these instructions. You would rub a scent, and you would smell it, and then there are 5 scents and pictures. By the way, that's really important that a lot of people missed. Pictures of what you're looking at to describe the scent. So there'll be 5 pictures, and you have to pick which one it is out of that scent. So you'll smell this, and I can't smell it. And then you'll look at it, and you'll pick one, and I barely smelled that. And then, oh, I think so. But you pass it at the end of it. You're like, how the hell did I get that? Memory, cognitive, file cabinet. We remember scents as babies. We actually are born with the ability. A baby deer will run the opposite way of smoke at its first smell of it. You follow me? It's like we have inherited protection with our brain that helps us protect us spitting out things that don't taste good that may be harmful. A baby tasting something it's never tasted before spits it out. Or if it doesn't have it, if it has glucose in it, they suck it up. They're like, so there's a lot of really neat things that go on that people are unfamiliar of. So it's an educational process. But as soon as you follow this test pattern, and the odds of getting these right are so astronomical if you have an olfactory disorder. And we've been able to measure and encapsulate these scents to a certain degree to find that Goldilocks where you got it or where you don't, to the level where we want to be able to detect it, but not over detect it or under detect it. And so we had to refine that process using a 3M technology encapsulation process. We have to manufacture these scents to a certain degree, encapsulate them with a certain process, and put them on exactly the same way. So every test is the same. So there's not one different than the other. They might rotate in scents, but the level of sensitivity is always completely accurate. That's very difficult to do. And that process allows people to, it's an objective test. It doesn't tell you have something. It does tell you have olfactory disorder, because the same person, give you an example, you would fail this test, if you took this test, it allows you, you're only supposed to take it once because you rub the scents off and they get weaker as you rub them. So you take one and just throw it away. And but you can take that same test that you failed and pass it to your daughter or another person, and they will pass that test that you failed. And you're like, how did that happen? I can smell fine. I smell. This is detecting asymptomatic scent disorder, the first and earliest sign of these 3 major conditions: viral, neurological, neurodegenerative, and concussion. There's sinonasal. Usually you can smell even with the cold. Your olfactory, many non-viral conditions don't affect your ACE2 receptors. Also, neurodegenerative disorders don't affect your ACE2 receptors. They affect their ability to move where they're supposed to go.
Yeah.
You got me? So if I've got Huntington's, those ACE2 receptors aren't getting there. They're blocked for some reason. Alzheimer's, they're blocked there for some reason. So this triggers this ability for you not to be able to smell as normal because of these neurodegenerative disorders that are blocking your ability to. So there's these great aspects of this test that come out that I'm so excited about. I can't stand it. I mean, it's like we have worked and progressed this test to this level. And now we've refined it. There's always room for improvement, but right now, as an objective test, FDA went ahead and gave us a registration, so we're ready to ramp out.
Medicare has also approved it for billing.
Yeah. So the hardest, you get an EOB, that's evidence of billing. So whenever you see a medical device that says, the first thing that they'll flash up on their site is with EOB. It's like, oh my God, we got an EOB, because you never get them. You got thousands and thousands of products every day rolling out, and they just don't qualify to get this level of effectiveness for an insurance company for its need of use. You can use that. You can put these in your shoes to make your heels, not hurt. We're not going to FDA approve that. You don't have to have it, but it's a good thing. And so all of these, when you get an EOB, and you get to the level of where you can submit to an insurance company, you have to have a lot of stuff, even just to submit. And you have to talk with them about it. And when they, for years, we spoke with them about it. And actual Medicaid back in 2018 invented the CPT code for this test when there was not one, because the need for it was so apparent. So when we contacted them, they said, "Oh, here's the studies. Here's your 98,700 CPT code. We have it there for you. It's yours. It's unspecified because no one's used it." We're like, please. They were like, please get this out there. This is a major disorder that's going to save our government a lot of money. So that kind of pushed us along. Okay, wait a minute. We got their backing. They're going to cover it. Now, once Medicare, it's so hard. Medicare is a paid government-sponsored insurance, where Medicaid is an insurance provided for people that can't afford insurance. Well, Medicaid is, they don't pay everything. You can ask a doctor. We don't even bill Medicaid. Oh, you got Medicaid? It's cash. They just don't, they never get paid, right? But when Medicaid covers something, or the government, Medicaid or Medicaid covers something, this triggers other insurance companies' demand to pay. So our goal was to get this Medicaid, and we didn't want to do that for a while because everybody else will still cover it, But if Medicaid doesn't cover it, oh man, we're gonna get a little fight. Well, we had a medical provider. Some of our doctors that have tested this nationally for years. We had one recently. Oh, Jeff, I billed Medicaid on a patient. I said, well, what? No. Oh, no, don't do that yet. I need to call them, And we're not really, we need to get enough EOBs from the top majors to show them. And they covered it. Full coverage. I was like, it was 80% coverage because.
Well, it's always an 80-20 with Medicare, Medicaid. Yeah.
Right. And Medicaid covers 100%. And also, most of your insurance providers cover 100% of all costs associated with a wellness.
Yeah, that has been a bigger thing the last couple of years, is wellness checks.
So that's there. And then your 80-20, some people have catastrophic insurance. They have a $5,000 deductible. They're very wealthy, can afford their own care. And they have a low to cover catastrophic events. And so you wouldn't cover it. So, doc, if you have a catastrophic coverage, just eat the cost. We'll eat it. Don't charge them. We don't want anybody to have to pay for this. And that's the way we've got it set up right now.
So
and
what
you're like, that's the,
for those of us, well, I am, but for those out there that are not medical professionals or work in these insurance fields, I hear you saying that you don't ever want a patient to have to pay out of pocket for this.
Right.
And how are you doing that? You're eating the cost. Is that what you're saying?
Well,
we worked out.
We're not going to be profitable for a while because of the cost incurred in developing the test. Okay. So, it's a lot of money that goes in inventing, but over time, it'll be the Clorox of bleach. We're setting the standard of assessment stage and preventative care testing for these top three that nobody's been tested for until now, that are killing people. And these are going to save lives. So you're going to save lives and lower healthcare costs to make our healthcare more affordable. So this is a win-win, and our projections over time, our evaluation's incredible. It's a $20 billion company. This is a massive, it's just really incredible what this test is going to do and how everybody's going to use it. Now, if I get everybody using this, help get our costs low, we can get these things down to pennies. And that'll be over out of attrition. That'll be a staple, like a cheap aspirin or a blood pressure test. It doesn't cost you anything. And they're just, everybody can use them. And you can keep them in your car. Going retail, that could be where you could buy them in a 20-pack, a home pack, and they're just sitting around your house. And, I feel like I got something. Oh, honey, you might have a virus. Go take a test. That would be a really great at-home indicator. Now, you can connect this, and a doctor can give this to their patients, and they can test them at home under their tutelage and instruction. In other words, you're not going to see me for a year, but you are susceptible for Alzheimer's. Your
Sure. Yeah.
parents, your siblings, you're 74 years old. I can't treat you for Alzheimer's until you have a symptom. And by
Too
the time
late.
you have a symptom, it's too late. So let me give you these tests. I don't want you to take these quarterly. And it's going to alert my office when you pass or fail, because I'm going to instruct you how to use it. I'm going to give it, it's like a doctor giving a prescription out and telling you to take these pills instead of me putting it in your mouth. He's giving you those pills and giving you instructions to take and that follow his medical recommendation. And the same thing, it's still insurance covered. So they can take them home if given from a doctor. And now later on, hopefully there'll be a revised version where it's just a little instrument in your hand that you can breathe into or smell or stick in your nose that detects it. So that's future AI stuff that we're leading into. But to be this accurate using mental storage, file cabinet storage, recognition of sense, you got to have a picture and you got to smell it and see which one it is and be wrong. And you can't do that with a lot of these AI tools. This is just refined to this degree to really detect it. But we're excited about it. So that site that you put up on your device, I'll continue. You'll get a pass or fail that is stored in your wallet, can be emailed to your doctor, or your doctor will have it, and it gets automatically billed to your insurance company upon use. They can then email those results, HIPAA compliant, of course, to your their recommended ENT provider for further testing that's insurance covered for a neurological scan and some other testing that you can't do on a football field, but you can do in a ENT office is specialized in olfactory disorder.
It sounds like it's called My Safe Pass, because if you pass this, you're safe. And that's the whole goal right there.
Yeah.
Jeff, you're definitely passionate. You definitely got the background and the thought processes to get there. And once I heard about this with concussions, it blew me away of how it makes so much sense to me, because I'm again a paramedic, but not on that level of, definitely don't have the education of the, man, you said you liked molecular biology. And it's like, I took a chapter of that paramedic school, was ready to rip my hair out, man. That's where this gray hair came from. Was it? So, but you understand.
Yeah.
And you made me understand.
Cornell, when you see a cell, when you walk into a medical classroom and you see there's a standard cellular chart that has the mitochondria, you know what I mean? You have all the little thing. And when you go to a Cornell University, that poster is chopped up into 1,000ths. And each 1,000th is a further deep dive into cells. And how they operate that's what I was like, no. It's like being a astronaut. I just loved it. So,
we need really people like you who are born for it, who are loving it. And the way you're able to explain it lets us understand it for those of us who are not born to love molecular biology. And I appreciate all that you've put into it. And it's My Safe Pass. And I got the site here. We'll have in the links and everything, patriotconnectionsppe.com/try-r-test, which is where you can just go online and play with it and see how it works. So thank you, Jeff, for being on We Serve Network. And I hope that this really does change the world like I think it's going to.
Oh, well, I really appreciate your time. Thanks for having me.